The deadly shooting at Fort Hood has the country racked with anguish, leaving many to ask why. The suspect shooter, Army Specialist Ivan Lopez, was being evaluated for post-traumatic stress disorder, but had not yet been diagnosed with the illness. Now, yesterday's shooting is just the latest in a string of killings at U.S. military installations. Joining me now is Dr. Jay Singh. He is an expert in violence risk assessment, and that is the science of determining whether someone will become violent. Did we say that correctly, Dr. Singh?
Absolutely.
I guess one of the things we should point out here is, as has been reported, the shooter was undergoing some treatment for mental health issues. But you have said, and other professionals have said, that we don't need to be so quick to make the leap between mental illness and acts of violence. Why?
You know, Leslie, oftentimes when I see these sorts of very tragic incidents occur, the first thing that comes to people's minds is the issue of mental illness. There's this general public perception that no one, quote, sane could perpetrate these kinds of very tragic acts. Some important numbers to keep in mind. The big one for me has always been that, let's say that we took everyone with mental illness out of the equation in the United States, we would still see between 95 to 97% of all violent crime. So this is the case where the majority of individuals with mental illness are certainly not violent. There have definitely been a number of studies that have established that mental illness is, in and of itself, a significant predictor of violence, but not nearly as powerful as other predictors such as unemployment, being male, being young, so on and so forth.
So how do you know whether someone who has a mental illness will become violent? I mean, in the case of Specialist Lopez, everyone around him apparently is saying they had no idea there was anything wrong. We heard today that there might have been an argument that precipitated his alleged actions. How do you know if someone will become violent?
You know, it's a very challenging thing, particularly when we're dealing with prediction at the level of the individual. Prediction at the level of the group is a little bit easier when we're dealing with larger populations. The key thing to keep in mind here is that when we're dealing with veterans, typically the motivations for violence come in one of three different forms. So the first is more interpersonal. Let's say you and I have an argument, Leslie. At the end of the day, one of us ends up being a little bit aggressive. And it's true that 1 in every 3 veterans returning from Iraq or Afghanistan in the past 12 months have self-reported that they have had these incidents of aggression, about 10% severe violent aggression. But what we see at the end of the day is that there's also individuals who are driven by the symptoms of their mental illness, or on the third front, are driven by simply not being able to inhibit themselves like they were before they saw combat. However, from what we know now, Mr. Lopez...
Doesn't sound like he did see combat.
Didn't see combat, seemed to have a very solid relationship with his wife and others. So it could be that one of the reasons why it was so difficult to be able to predict in this specific case, it's hard to know without knowing the actual evaluation procedure the person was put under, but it could be that this has actually very little to do with mental illness and much more to do with simple human interactions.
Well, Dr. Singh, obviously there's a lot more to talk about. We have run out of time for this segment today, but in every case there's always a question about how do we keep this from happening again.
Absolutely.
Do you have a quick answer?
You know, I think that it's very important to make sure that clinicians, particularly those working for the VA, are very well versed in terms of the current research literature that we know about in terms of evidence-based methods for the prediction of violence and being able to really tailor these more towards veteran populations as opposed to civilian populations.
Dr. Jay Singh, thank you so much for your insight.
Thank you very much, Leslie.